Hey everybody, today we're going to hit the hot topic, filler. Sometimes my patients aren't thrilled when I tell them IEH doesn't offer dermal fillers. I'm not against fillers, and if they're used judiciously with neurotoxins, fillers can be very effective. And of course, they give an instant result to solve several facial concerns. Fillers are also quite effective if your goal is more lip volume. But if you ask me if fillers are safe long-term, my answer is we don't know. And this is why I choose not to offer dermal filler to our patients. Aesthetic fillers have been used for about 15 years and are now widely accepted by people of all ages to treat things like loss of facial volume, shape concerns, and even body concerns. In fact, dermal fillers are very effective for facial balancing and restoring facial volume, and of course, the effects are immediate. Some of the most commonly used fillers are hyaluronic acid based. These are marketed as HA, hyaluronic acid, and natural dermal fillers. The manufacturer of fillers tells us to expect the product to last 9 to 24 months, and so that's what your injector will likely tell you. However, there's more to know. In a nutshell, injectable filler is not a natural product that stays in harmony with your biology. Whether or not an individual body will absorb the product to the point where it will be fully dissolved out of the body, that is a long-term question that the medical field doesn't have an answer for today. In fact, filler is relatively new as an aesthetic product, and its long-term effects are just starting to show up in people who've been using it for multiple years. When you get right down to it, it's important to remember this. Anytime something foreign is introduced to your body, your immune system will react in its own way. Not everybody's biology is going to like that filler in there, as it's foreign to your body's biology. So let's talk about what HA is. HA, hyaluronic acid, is a sugar found in the tissue of the skin, as well as the connective tissue, our joints, and even our eyeballs. The role of HA is to give a little hydration to your tissue. It actually gives your skin that lovely plumpness, and it does this for other tissues as a support structure. We naturally have HA in our bodies, and the process is that HA is deposited and broken down every 3 to 5 days by your body. If I injected natural HA into your tissues, your body would just break it up in the next 3 to 5 days. So why does HA dermal filler not do this? Why doesn't it break down as fast? Well, it's been modified. Filler companies put the actual natural hyaluronic acid through a process of cross-linking, which makes it a little different molecularly than your own body's natural hyaluronic acid. They do this to allow it to be more soluble and more stable where it's put, so that it's not broken down quickly. So actually, when your injector tells you it's HA and naturally absorbed in your body, this is not quite the whole story. If you're getting filler and getting it regularly over a long period of time, your tissue is slowly being changed by the filler product. Remember the cross-linking I mentioned? Well, this changes the molecular structure of HA to make it more soluble. That means it's going to hold moisture. And there's a catch. This is the part I struggle with. The molecular manipulation of HA filler products is designed to hold more moisture, so it actually expands rather than dissolves. And this expands your skin tissue. What happens when your skin tissue expands? Not good. Anytime you stretch the skin, it's not going to go back 100% to what it was. If you gained or lost weight, it's the same idea. As time goes on, that expanded skin, it's been compromised, and it will continue to be less firm as the years go on, the more filler you get. If you need to dissolve the filler, you've got all kinds of underlying issues with the skin and its supporting tissue. And there's another catch. While fillers seem like an ideal option for achieving immediate results, the long-term effects of using filler over the decades are only beginning to be observed in the medical community. MRI scans show that filler doesn't fully dissolve. It can gravitate and settle in undesirable locations in the face, commonly under the eyes, giving the appearance of puffiness and swollen eyes. Inevitably, age catches up, and people with filler have loose skin and end up going for facial plastic surgery. And then we see what's under the skin. Plastic surgeons are noting tissue changes in the muscles of the face. The HA filler becomes sticky over time under the skin layer, and they're noticing a degraded texture of the facial muscles. Please, pay attention when I say that as we age, we want our facial muscles to be in good condition, because these muscles are the support structure for our entire face. And when our facial muscles are compromised over a long period of time, whether from filler or neurotoxin, you're not going to be happy with your appearance when you're in your 50s, 60s, and beyond. This is why I started Integrative Wellness and Aesthetics by Halo. We focus on skin health to slow down the visible effects of aging starting at the cellular level on the inside. So if you do decide to use fillers and neurotoxins, we'll help you optimize your skin and slow its aging. So if you're going to use those fillers, you can start later and hopefully use less. So what's an alternative? We're focused on staying in front of the research to offer you advanced, science-backed, natural alternatives like PRF filler to allow your own body to generate the cells necessary for additional collagen production and fullness. Mesenchymal stem cells can encourage natural cellular rejuvenation of new tissue growth without the risks of long-term unknowns from injecting pharmaceutically altered products. Keep it natural and make sure to subscribe to our blog and keep watching.